You booked a 4-day all-inclusive trip to the Maldives, and the place looks perfect, but there is only one catch. You are not allowed to know how much your stay is going to cost until you're done with your stay. When you ask the staff, they cannot tell you how much your stay is going to be. That's kind of weird, right? But that's how most hospitals and health systems in the US function. So that's leading to a higher out-of-pocket cost for most patients, and the healthcare business and both the government and the private healthcare system has ballooned to $4.5 trillion industry.
So, what's the problem we are exactly speaking about here? We know the health insurance market is 1.3 trillion, and typically we are all insured and we should be covered, but as he told you, we know what exactly we are insured for, because there are always surprises. Life is full of surprises, but I'm not sure this is the kind of surprises we want. So our prime focus market is the small employer segment, which is somewhere around 500 billion, that's 90% of companies in US, and we are estimating the 500 billion annual problem combining high premium, where typically compared to a large enterprise, the smaller business work around 20 to 30%, and they also have an out-of-pocket burden. For example, the larger enterprises have 1,200 out-of-pocket, the minimum threshold, whereas for smaller organizations it's 1,600 and above on average. And the lost productivity for the SMB employees while they are struggling with this hassle and like losing their sleep over it, and at the same time the poor turnover. So typically again, 25% of the turnover is associated with health related issues which can be easily avoided, and again estimating a cost of around 5 to 15K per replacement. And finally, the administrative waste, where a typical HR in a smaller firm spends around 40% of their time addressing these issues, which is not core of their work, whereas on a larger enterprise it's much smaller, like 10 to 15%. Now, why does this problem exactly exist? Because as a small firm you have relatively negligible or even zero bargaining power with the hospital, and the user base is fragmented, which also means, given that let's assume I have only 10 employees or 50 employees, I would be hospital would be considering me as highly risky, so I would be paying a very high premium for each of the employees because it's a fragmented market. And bad brokerage incentives, typically most of these firms go through brokerages to deal with hospitals, but brokerages make more money if they get more premiums, so the entire incentive structure is misaligned in the system, and the administrative complexity, where a typical HR is not trained or even the relevant authority to solve this. And then there's also the challenge of adverse selection, where you are a firm of 10 people, let's say one employee is highly risky, it shoots the premium for your entire organization.
So what is the solution, especially for small and middle-sized companies and for primary care? Our solution is Airbnb for clinics. One mechanism is to provide simple first dollar access for employees, where we won't require employees to meet their deductible. Small and middle-sized organizations will have a contractual tire-based agreement with CarePrice. Then their employees will get a package deal where they will get unlimited primary care with no surprise out-of-pocket spending, with no fee for service. And also for cloud clinics, telemedicine companies, and also actual small clinics will provide a marketplace for direct primary care package where they can host their procedures and appointment slots in one place and work with them. We will work with them to offer defined primary care packages. This is our prototype.
So let's assume you are a patient. You land up on our website. You just describe the kind of issue which you are facing and click. So you can see all the nearest hospitals around your region and what's their immediate available slot and what's the amount of credits it should be. So very simple. It also means you are able to access multiple clinics in your neighborhood at a close proximity on a priority basis based on the availability of doctors, and at the same time we are optimizing the scheduling problems for the smaller clinics. So we would be providing the back end of the CRM where they can see their scheduling and everything for free for the doctors, so that eventually they'll start using more and more of this, and it can integrate with their existing booking system, or they can migrate completely onto our platform where we'll be incentivizing them to migrate so that their customers, and through the network effects we are able to scale it.
So the target audience we're considering are for the employers. These are going to be middle and small sized employers, ideally with 10 to 250 employees, and those are mostly cost sensitive for premiums and deductibles. We're starting from St. Louis area, and for those with a lean HR team where they want a simple and primary care benefits where they want to offload their HR workload burdens. For the clinics who would post their package on our website, we're trying to focus on small and independent primary clinics, ideally those with hybrid models of telemedicine plus in-person clinics, and those that are not currently overbooked and looking for new patients, and of course based in St. Louis. Our team have like a wide variety of expertise. I'm a medical doctor and studying masters in public health, concentrating in health policy analysis at WashU. I have experience in sales and marketing. Vikas is an MBA candidate at Olin Business School and has an experience in data science and developing different gamified versions of organizational trainings. Thank you.